Hello students, I am Nurse Romero. I'm an OB nurse at Advent Health Hospital. I'm here to talk to you guys about my nursing journey and how I became a nurse. So I'm going to start with what inspired me to become a nurse. I've always been a very giving person personally, and I've always been one to want to help others and just kind of fix others in any way I can. I've always been that type of person to give like a lot of help to others in need. So I feel like nursing was the perfect career for that. And I did struggle with picking a career, but overall, nursing is a very caring career, and I feel like it was for me. So after that, I started at Valencia College in my senior year with the dual enrollment program, and a few courses that really stood out to me. One of them was new student experience. It helped me find my weaknesses, find my strengths, helped me decide and plan for my future, like career-wise, and as well as anatomy and physiology. That one was a little bit stressful for me, and it's quite difficult, but I was able to make it through because I remembered that I really wanted to be a nurse, and I really had a set goal. It's important that you guys set goals beforehand and really remember what you're working for, and I'll get to that later. But so a few nursing prereqs. Nursing prereqs can be very annoying, but it's important to stay motivated and to push through. So as far as degrees go, I got my AA after 2 years at Valencia College. I got it in general studies. I did the Direct Connect program to UCF, so I did my BSN at UCF, and that includes nursing school and all that, so that was only 2 years. So it would be a full 4-year bachelor's degree, but I started at Valencia and then I went to UCF. And then I took the NCLEX exam and I passed and I became an RN, registered nurse. So I just have my cards here in case I forget anything. But I wanted to go over the costs of college. It's important that you guys realize the cost of college is extremely expensive and it can be very expensive when you don't have a plan. So it's important that you guys sign up for grants, scholarships, try work study. That really helped me a lot. I did work study, and definitely go and get a job, which work study is a job, but make sure you get a job and don't rely on family contributions. Save up as well, because at college, once you look at the numbers and add up the numbers, it gets expensive, it gets real. As far as support system goes, it's really important to have a support system in line. I had my best friend whom I've known since my whole life, and you don't have to have a best friend that you've known your whole life, but it's important that you guys have friends. I had a study buddy. I had my uncle and his friend who is an OBGYN, and my uncle is a doctor, so he really helped me and helped me push through even in those dark days. It's really just important to have your family around for that and your best friends around for that. So as far as internships and shadowing opportunities, those are very important. I did most of my shadowing opportunities and internships at Advent Health. I would suggest that you guys really take any chance that you get to do some internships and shadowing opportunities at any hospital, any hospital closest to you. Make sure to take very good notes, ask questions on the scene. Even if you think it's a dumb question, no question is dumb. Ask the nurses, nurses. If you want to shadow a doctor because you want to see what doctor life is, go ahead and ask the doctor questions. Take notes. Connect with the nurses if you want to be a nurse, of course. Connect with the nurses. That's what I did, and I made sure to stay in touch. And because it's important to get letters of recommendation, and it's also important to have a support system, as well as I said before. So after all that hard work, I became an OB nurse at Advent Health. Yay! So some of my daily procedures include labor and delivery. So I'll assist the actual OBGYN who is there. I clean up the baby and stuff like that. I do birth control, I do pap smears, which is the exam down there, and I also assist with breastfeeding. I'm not a lactation consultant, but I do assist with breastfeeding. Some of the hard skills that you need when becoming a nurse, you gotta learn how to deal with needles, you guys, because I was never a fan of needles, but I had to become, be on needles' side because, hey, we all need needles. So, with IVs and phlebotomy, blood work, which is phlebotomy, I just wanted to make that clear, but it can be a little bit squeamish, but it's important to deal with that, as well as catheters. Catheters are very annoying and very weird, but it's important to get familiar with catheters, especially with postpartum hemorrhages. The ladies need catheters. So I want to go into postpartum hemorrhages just to give you an example. Postpartum hemorrhage is when the mother starts bleeding out, and because of not having contractions, so she needs to be able to have a catheter inside of her so that she can pee, and so that the contractions can start happening once again, so that she stops bleeding. Telemetry, reading the machine that's right next to the patient. That's important too, and it can be difficult for some nurses, because a lot of things are happening at once. And dealing with bodily fluids, especially with birth. I mean, any type of person in the medical field is going to deal with, unless you're a technology person, something like that, but any person is going to tell you that they deal with bodily fluids. So you got to get familiar with that. You might never get used to it, but it's there. So some soft skills include time management. Always have a planner with you. It's very important to always have a planner. Set goals, plan your day as much as you can, but you might need to squeeze something in, so always carry your planner. Patience. It's very important to stay patient with your coworkers and your patients, as some of them can be rude. Endurance. You need to have a lot of motivation for this and a lot of pushing through. And critical thinking. It's important to have critical thinking in a timely manner as well. So finally, my personal tips. Start out thinking about your values and what you're working for. Remember what you're here for. Remember what you've strived for. Remember what you dreamed for. Have a personal purpose statement. Mine is, my purpose is to stay motivated, sturdy in my beliefs, and to be an uplifting person, not only for myself, but for others. It's important that you constantly remember that. Write it down somewhere where you can see it every day. So I want you guys to set goals every so often so that you stay motivated. That really helps me stay motivated, really helps me remember what I'm here for. Explore classes. There's so many classes to take. Like pottery. If you want to take pottery, take pottery. It'll help you find your interests more. Stay motivated, take personality tests, have a good support system, and you guys don't ever stop working hard. So that is all that I have for today. Have an amazing day, you guys. Thank you so much for having me.
Why didn't you go all the way and become a doctor?
Let's save that question for another day. Okay.